The Philippines ranks last yet again in a report measuring the government's pandemic response efforts. Nikkei's recovery index shows the Philippines is likely to be the last among 121 economies in the world to recover from this health crisis. This report comes a week after the country also placed last among 53 countries in Bloomberg's COVID resilience ranking. Let's dig deeper into the index with Grace Lee from Nikkei Asia. She joins us now from Tokyo, Japan. Grace, thank you so much for joining us. The Philippines is at the bottom of the heap at 121st place. Its previous ranking was 108th at the end of June, 106th by July's end, and 120th by August end. Why is the country continuing to fall according to your data?
Thanks, Rico. So the Philippines ranking has been low since we published the index in July. It got lower in the last 2 months because of its recent wave of infections, which has been the worst so far and really affect its infection management scores. From our website, you can see that the index look at 3 things: infection management, vaccination, and mobility. When we look at segment scores, the Philippines gets 6 out of 30 in infection management, ranking 114th among 121 countries and regions. At the same time, vaccination still lags, getting a score of 16, ranking 73rd. And as far as I know, there has been some form of lockdown in place in the capital region. So the strict social control led to a low mobility score of 8.5, which also ranks 114th. So 3 factors combined, it's not surprising that the Philippines ended up in the lowest position in our latest ranking.
And Grace, the government has been on the defensive after the report of Nikkei Asia came out. Let's listen in to the Health Secretary, Francisco Duque, and the Vaccine Czar, Carlito Galvez, on what they had to say about your recovery index.
They're comparing apples and oranges dahil unang-una, yung mga bansa na inassess nila, wala nang surge. Samantalang tayo, pababa pa lang.
Mali yung ginagawa ng kanilang mga researcher. Unang-una, kulang ang data nila. Nakikita natin yung Nikkei at saka yung Bloomberg, they are all business-oriented. Hindi nila binasihan yung tinatawag natin yung debt.
So you heard Duque, he said his statement in a mixture of both Filipino and English. He's complaining that you're comparing apples and oranges in countries that you assess. And Galvez says your researchers are doing the wrong thing and your data is insufficient. So Grace, tell us, what is your data based on? And share with us, what are the factors in calculating this data and who are your sources?
Sure. So as I mentioned, we're looking at 3 aspects of a country or region's COVID situation. On infection management, we grade the countries based on the number of tests conducted per confirmed case, the daily case count per capita, and how the daily new case number compare with the country's own peak level. For vaccinations, we assess them on the total vaccination doses given per capita, latest daily doses given per capita, and the share of population who have been fully vaccinated.
But where are your sources coming from? Where are the numbers coming from? Who are your sources for this data, Grace?
So for these 2 categories, we got data from statistics website, Our World in Data. And for mobility scores, we use Google mobility reports and also the Oxford COVID-19 government response tracker and the flights data from a company called Serum.
Because according to the government, Grace, the World Health Organization said the Philippines is among the Asian countries that have low case of fatality rates, which means we're doing well in terms of managing severe and critical cases. Was this data also taken into account in your recovery index?
We are not right now looking at the fatality rate because we think the data is not complete for all the countries. It could be distorted in a way that if some countries have really low case count and then there's suddenly a death case, it will show the country to be in a really critical situation, which would be inaccurate.
So your recovery index came out in the first week of October. The next one will be in the first week of November. from the data that you've seen over the past months, because the government is saying the data that you use was when the Delta variant was at its highest surge here in the country. Do you see the Philippines improving its ranking as more vaccines arrive in the country?
Vaccination is definitely important, and it has been an area where progress helped to improve the rankings for some other countries. But I think what's also important is to see whether the Philippine government can continue to bring the cases down while trying to relax the curbs to revive the economy. If that can be achieved, then very likely we can see a clear improvement in the country's next ranking.
The other member states in Southeast Asia are also among the lowest ranked, but in September, Malaysia's ranking increased from 115th to 102nd, and Indonesia from 92nd to 54th. They were hit also very hard by the Delta variant. What are our Southeast Asian neighbors doing right at this point that the Philippines can learn from?
For Malaysia, it's definitely the country's vaccination progress. Its vaccination score is 27, ranking 5th of all the countries. Actually, Malaysia's vaccination rate more than doubled in the past 2 months, and we can see its cases also falling down from the August peak. For Indonesia, which was a major epicenter in July, but now the daily case number is about 3% of that level. The country is also doing much more testing than before.
Looking forward to the next Nikkei Asia Recovery Index in the first week of November, and we will definitely want to see if the Philippines has risen from its rock bottom place of 121. Thank you so much for joining us. Grace Lee joining us from Tokyo, Japan.